Are you hearing a pop, click, or crunch in your jaw? Maybe it hurts when you're chewing your favorite snacks. Or maybe you're grinding your teeth and clenching your jaw all day and all night. That sounds like TMJ. And today, we're breaking it down in a super simple way so that you understand what it is, where it comes from, and more importantly, how to fix it. This is Dr. CeCe. Let's fix that jaw. TMJ stands for the temporomandibular joint. It's where your lower jaw, called the mandible, connects to the temporal bone in your skull. It's a complex little joint made up of bones, cartilage, ligaments, and muscles. This little joint is actually one of the most used joints in your entire body, responsible for opening and closing the jaw, enabling you to speak, to chew, to yawn, and to clench your jaw during traffic. So, how do you know when your TMJ is upset? Here are the top signs: clicking and popping like your jaw's trying to start a lawnmower, jaw pain, especially in the morning, and of course, clenching, grinding, and gnashing your teeth for absolutely no reason. You can also experience headaches or temple pressure. Remember, it's the temporomandibular joint, and because of that attachment, headaches and pressure in the temple area are a very likely result. You may feel ear pain or fullness, and that's because the jaw and your ear are close neighbors. And of course, tightness in the face, neck, or even your upper traps could be prevalent when the TMJ is upset. If you've seen any of my other videos, you'll know that I am a nerd for nerves. So, we'll quickly go over what powers this little joint. The TMJ and the muscles surrounding it are innervated by cranial nerve number 5, which is called the trigeminal nerve. It's the 5th nerve to be developed in your body. The trigeminal nerve has 3 branches, but our focus is just on the 3rd branch, which innervates the muscles of mastication, chewing, opening and closing the mouth, and providing sensation to the lower jaw, the teeth, and the first 2/3 of the tongue. So, when I say the trigeminal nerve innervates this area, I mean that it controls this area. It makes it move, opening and closing the mouth to speak, to chew, and to yawn, and providing feeling to the area, allowing you to feel pain, temperature, and awareness of the position of the jaw, called proprioception. Common toothaches, wisdom tooth pain, dental infections, jaw muscle pain, TMJ pain, clenching and grinding the teeth, all involve that 3rd branch of the trigeminal nerve. Now, the jaw isn't just one muscle. It's a team of muscles, and some of them may be tiny, but make no mistake about it, they are very mighty. Can you name the strongest muscle in the body? The strongest muscle in the body is the jaw's masseter muscle, by force, because it's capable of exerting up to 200 pounds of pressure on the molars. The temporalis muscle is the headache muscle. The medial pterygoid, the jaw elevator. The lateral pterygoid, the disc stabilizer and trouble starter. And the suprahyoids, they are the floor of your mouth that helps open the jaw. When any of these muscles get tight, you definitely feel it. There are a handful of VIP troublemakers that trigger TMJ pain. The biggest offender is incorrect tongue posture. Some people just don't know what to do with their tongue or how to properly place it in their mouth. Your tongue is just as important as your spinal posture, and we'll go over how to correct your tongue posture in just a few minutes. Other top TMJ offenders include stress and clenching. And yes, this includes the I can handle everything type of stress. Stress ties back to the nervous system, and when you're all riled up, that trigeminal nerve lashes out. Stress and anxiety can significantly contribute to the development and worsening of TMJ issues. You must control your thoughts. Your muscles respond to your thoughts. Clenching, grinding, gnawing are a sign of stress, tension, anger, anxiety, and other types of negativity. Emotional stress can be a trigger and can create a vicious cycle where stress leads to grinding, which in turn worsens the nerve pain, causing more stress. Here's a tip. Stop reviewing and reliving the past. It's gone. Stop worrying about the future. It's not here yet. You have to trust yourself enough to live in the present and know that you can handle whatever comes. I know that that's difficult, but remember, chronic stress and anxiety can and will affect your nervous system. There's also muscle imbalance. Your masseter, temporalis, and pterygoids are muscles. Your left and right side should be symmetrical. However, because of habits like chewing gum or chewing your food always on the same side, can make one side of your face more dominant and inhibit the other side. What that means is that one side is doing all the work and is overloaded and overwhelmed, while the other side is weak and underused. This can stress out the overworked side. Remember, your TMJ is the most used joint in your entire body, so you are always using it. We have to address spinal posture. Forward head posture or anterior head carriage is a condition where the head juts out forward from the shoulders, placing strain on the neck and upper back. It's often caused by poor posture from activities like prolonged computer or phone use, and can lead to neck pain, headaches, muscle tension, and nerve issues. For every inch that the head moves forward, the neck bears about an extra 10 pounds of pressure. This negatively impacts the TMJ by creating muscle tension and increasing pressure on the joint because it puts pressure on the neck and jaw muscles, and it alters jaw mechanics. It causes the condyles to move abnormally during opening and closing. Your jaw hates it because it has to move back and up to compensate. How big is your mouth? Let's test the jaw's active range of motion with the 3-finger jaw test. See if you can fit 3 stacked fingers vertically between your top and bottom front teeth. Normal is about 3 finger widths. So, you're going to use your index, middle, and ring fingers on top of each other vertically and insert them into your mouth. If you can comfortably do that, your jaw has a normal, healthy range of motion. If you cannot perform this test or experience pain or difficulty doing so, it may suggest a displaced disc within the joint degeneration, or more severe TMJ issues. You may need to stop here and consult your dentist for a full evaluation, or consult your medical or chiropractic doctor for a full eval with an MRI. You'll need a specific TMJ MRI to get a really good look at the joint and the muscles, the discs, and the ligaments surrounding it. Okay, proper tongue resting posture. Whenever you're not chewing or speaking, the tongue should rest gently on the roof of your mouth, just behind the upper front teeth. You do this by making the N sound. You make the N sound and leave the tongue right there. Now close your lips gently. The teeth should be lightly apart, not clenched. Now suck all the saliva from your mouth and swallow. The first 2/3 of your tongue should now be sort of sealed to the roof of your mouth. This position helps to relax the jaw muscles and reduce pressure on the joint, the TMJ. This is the correct resting posture and placement for your tongue and the jaw's happy place. Now, you'll need to stay vigilant and aware of your tongue's posture throughout the day and consciously reposition it when necessary. If you wear a mouthguard to sleep, continue to do so, while still making sure to position your tongue correctly. Other fixes include a masseter self-massage. Find the chunky muscle on the side of your jaw and gently massage it for 20 to 30 seconds. You're going to want to do this about 3 to 5 times a day. You can also do controlled opening exercises, keeping the tongue on the roof of your mouth while you slowly open your mouth just halfway. Then you close it, and then you open it again halfway. And you're going to keep repeating this for about 15 to 20 reps. This is perfect for retraining the jaw to move straight. You'll also need to correct your spinal posture. Remember, a forward head pulls your jaw off alignment. Think chest up, chin back, tall neck. You can use heat and relaxation. Warm compresses and deep breathing equals a muscle chill mode. Some bad habits to stop immediately are gum chewing, nail biting, side chewing, and phone cradling. Also, face sleeping. The best sleeping position for both your spine and your jaw is to sleep on your side. You may also need to cut down on caffeine and sugar. High levels of sugar and caffeine can trigger TMJ symptoms, causing the jaw to clench. Cut down on coffee and other caffeinated beverages that can overstimulate the nerves and wreak havoc on the nervous system. High sugar intake can worsen TMJ pain because it promotes inflammation and puts stress on the jaw muscles. Lowering your sugar intake can help manage TMJ symptoms by lowering inflammation. You may also want to add some vitamins to your daily routine. Magnesium helps relax muscles and reduce inflammation, and B6 and B12 are essential for nerve function and may alleviate pain. And don't forget professional care. Regular dental checkups are important. If you have missing or decaying teeth in your mouth, then you'll need to get that fixed. Regular dental visits can help identify issues that may not be obvious to you, like infections and wear patterns. You can also try chiropractic care. Of course, TMJ and cervical adjustments can help you stay in alignment. So find a good chiropractor to help you stay well adjusted. You could also do soft tissue work, dry needling, and muscle retraining, and so much more, depending on the root cause. Pop quiz. Can you answer these 3 questions? Should your teeth touch when resting? What's the strongest muscle in the body? What's the jaw's happy resting place? I'll leave the answers in the comment section. If you found this information helpful, hit the like button and subscribe for more natural solutions to everyday common issues. This is Dr. CeCe. Thanks for watching. See you next video.